Good afternoon and welcome to everybody. Rocket Trader, Imran Khan, Release Khan, Soumi, Pooja, Roger and many more across the country. Sorry, got a bit delayed. Can you please punch whether the voice is loud and clear, everybody? So let us pick up at least some 100 questions and try to quickly run through and know where we are good, where we need to improve to make the NEETPG a happening game. So 20-year-old female was operated for the perforation and there is peritonitis, and after closing the rectus sheath of the abdominal wound, there is a healing that is happening by the formation of the granulation tissue. Now the question is, what type of healing do you like to call it as? So it is called healing by secondary intention. So what is healing by primary intention and secondary intention? When the edges are clean and they are held together with ligatures, there is little gap to bridge the healing, and the healing is uncomplicated and it occurs very fast. And the gap gets filled within about 2 weeks. That is called primary intention. Whereas when the edges are quite separated, the gap cannot be simply bridged unless there is a formation of the granulation tissue, which is called the healing by secondary intention, is what you need to appreciate. A 50-year-old hematoma in the left gluteal area, and it is very painful and large, and it is causing neurological deficit. What is the next thing that you want to do? Question number 7. Please punch your answers, doctor, everybody. Simply Medi. Imran Khan is our new classmate in this Chai Pe Charcha classes. Imran Khan, you are from which place of the country? Aligarh or Gwalior, or from where are you? Please punch your answers. I can see Abhiraj saying C. Janvi Bhatt is saying C. That's right. Incise or aspirate the hematoma is considered to be the treatment of choice. 18-year-old has a closed lower limb injury from a motorbike accident. Very good. Imran Khan is from Rajasthan. So where is Aligarh located? UP? Okay. So it was a little wrong guess. So what is the probable diagnosis where there is a severe pain on passive motion? Classically is a very important question. It is the compartment syndrome where you have a pain on passive motion is what you need to remember. A surgeon told the patient that he has a flesh-eating bug, which is the cause of the severe infection. Which is that bug which is called the flesh-eating bug, leading to necrotizing fasciitis, classically, is my question to all of you. Question number 9. Shika Mumka thinks Staphylococcus aureus. Okay. Ritu Raj is thinking Streptococcus pyogenes. Simply Medi is thinking Clostridium difficile, but it is Streptococcus pyogenes is what you need to remember, which is notoriously called the flesh-eating bug, which is causing the severe infection. Polypropylene suture. Once more, doctor, NEETPG exam में one question on suture के बिना question paper नहीं रहेगा. So you should all be very sure. Very happy to see 114 online students attending on this wonderful Sunday evening. We have only 2 more Sundays. After that, the third Sunday is Dharma kshetre, kurukshetre. You are all fighting the battle of NEETPG. So, let's add up in our energy in the next 2 weeks of preparation. So, question number 10. I can see Abhishek saying D and Samsung is on the B. Okay. Yes. So, right. So, you should remember Karthik Kancharla is absolutely right. Monica Sharma is clean bold. So, you should remember polypropylene is a synthetic monofilament non-absorbable suture, low tissue reaction and a high tensile strength is what you need to remember. So what should Monica Sharma, Chamoy Ghosh, Rais Khan, आप सब लोग क्या करना? दोपहर ये सेशन होने के बाद एक अच्छा बिरयानी खा के take a little nap, get up, go to the reading room. Sutures is the topic which is there on the U-Medico video library in both DNB, JIPMER, AIMS, in all these question bank discussions, topic wise we have the topic available. Review that sutures lecture, video lecture on the U-Medico and be confident, play a quiz on the sutures in the surgery and get 8 out of 10 score and be ready. One question, without sutures there is no NEETPG. A 60-year-old pyothorax treated with intercostal drainage. The meniscus of the fluid in the tube is not swinging when she is taking respiration. What is the most likely possibility? Whenever chest tube blockage is there, when the air is not moving in and out, then there is no swinging of the fluid in the drainage. So that is how you will be able to identify. With regard to the removal of the drain after the surgery, what is an important principle? Question number 12. Give a confident answer, doctor. Question number 12. About the removal of the drain after the surgery. I would like to know your common sense answer. You know, this kind of questions, prepare होके answer नहीं कर पाते. Situationally आपका general knowledge का इस्तेमाल करना पड़ता. So, Samsung, Rocket Trader are betting on B, but only the Chimoy Ghosh, common sense only, is working now correctly. Very good. Ghosh Jindabad. Drain should be removed as soon as it is no longer required. If you know English, you can answer this question. Definitely, what is the opposite statement of this? Drain should not be removed even if you no longer required. Can that be correct? It cannot be. So, it's a common sense answer. That's right. Even Akkireddy Madhavi's common sense also is right. The chief of laparoscopic surgery asked his assistant to give him a laparoscopic port which has no chance of capacitance coupling during laparoscopic surgery. Over the head shooting. Laparoscopic surgery kaha? Laparotomy ही undergraduation में अगर आप regularly surgical theatre जाके humbly if you stand before the surgeon, every day if you show the face for 1 month, वो एक chance देता, चलो बेटा, please assist me बोल के बोलेगा. But modern time students, अरे PG entrance में सीट मारने के बाद कैसा भी MS जनरल सर्जरी में करेंगे, अभी क्यों करना? That kind of situation is prevailing. So there is a reason, ये बहुत दूर की बात, capacitance coupling. But what is capacitance coupling? Capacitance current typically is produced when two metal structures sandwiched by one insulator between them. When a metal hook or any instrument which is used as a diathermy, then the current which is being generated is dissipated through the abdominal wall. So unless you use a plastic cupped portal which can act like an insulator, you can't avoid this electric shock in the abdomen while you are doing diathermy, is what you have to basically understand. It's a simple thing. That plastic is an insulator. That is what you need to fundamentally understand. That's all. So what is meant by a harmonic scalpel? It uses the ultrasonic technology to cut and coagulate tissue. A harmonic scalpel vibrates at 20,000 to 50,000 Hertz, and it will lead to protein denaturation, and that will help in sealing the vessel. That's what you need to understand. Southampton wound grading system for the asepsis. Basically, what does it do is the very important question. Very easy question. It knows the severity of the wound infection. So what is Southampton wound grading system is having? You call 0 if it is normal healing. Normal healing with mild bruising or erythema, you call 1. Erythema plus other signs of inflammation is 2. If there is any serous discharge, it is 3. If it is a purulent discharge, it is 4. Or if it is a very severe wound infection, with or without tissue break, it is called as 5, is what you have to appreciate. A 75-year-old diabetic man, he had surgery for perforated colonic diverticulitis in his post-operative period, and he has spreading inflammation. There is crepitus with subdermal gangrene. What is the most likely cause for this kind of a necrotizing fasciitis is my question to all of you. Absolutely, it is called Murali synergistic gangrene, is what you have to fundamentally appreciate. So what is Murali synergistic gangrene? It's a natural tendency for you to jump and answer it as Clostridium. But this is fundamentally a colonic diverticulitis leading to the development of this infection. So the organism is most likely to be E. coli rather than Clostridium. And non-clostridial abdominal wall infections is called as the Murali synergistic gangrene. And what are the organisms in Murali synergistic gangrene? E. coli, Staphylococcus, Bacteroides, and anaerobic streptococci. Often this happens because of a perforated viscus leading to the infection, is what you need to understand. Most important clue for this kind of a gangrene is pain, which is out of proportion to the clinical signs. Clinical signs like abdominal rigidity, etc. Pain is out of proportion to the clinical signs. The symptoms are out of proportion to the signs, is what you need to appreciate. Now, what are congenital sinuses? What are acquired sinuses? A very easy question. Question number 21. Should your answer, Dr. Surender Ilikatte? Absolutely. Very nice to see a lot of new students every day. Thank you very much for spreading the news that there is a free class every day evening 6 to 5 to 8, and every Sunday 9 to 12 is the test and 12 to 3 is the discussion. All the 365 days across the year, any day for you to come back, join your classmates and get inspired to prepare. So that is the Chai Pe Charcha classes by Dr. Murali, who has no other job, who don't know to do any other job but to teach passionately to his wonderful students across the country. So please do come and tell your friends also to join. So question number 21, I can see most of you saying pylonidal. Absolutely right. So if you look at the congenital sinuses, preauricular, umbilical, urachal, coccygeal, sacral, they are all congenital. Pylonidal, tuberculous, actinomycosis, osteomyelitis, Crohn's, hidradenitis suppurativa, post-surgical. They are all the examples of acquired sinuses is what you need to remember. A obese 45-year-old lady, chronic smoker, tender subcutaneous nodule with chronic inflammation with a scarring under her left axilla. What is she basically suffering from is a very, very important question. Question number 22. Axillary scarring. Very important clue for you to answer. Shoot your answer, doctor. Parallelly, you need to jump and shoot the answers. If you answer this question paper 9 to 12, already you will be ready with answers for you to jump. Dasari Sushmita is proposing B. Most of you, absolutely. Hidradenitis suppurativa is an autoinflammatory condition caused because of the friction from the clothes and body folds. There is an aberrant immune response to all those commensal flora, bacteria, follicular occlusion, release of pro-inflammatory cytokines, over which there is a secondary bacterial infection, inflammation is what you need to understand. Supracondylar fracture of the humerus, clinical management kar rahe to, what are the complications? And which is the most high priority complication that you need to manage while treating the supracondylar fracture is my question to all of you. You have to quickly punch your answers. Then only we can finish all the 100 questions. For that, 9 to 12, you should solve the paper, right? Which is available as the PowerPoint. Very good. I can see most of you saying preserve the brachial artery entanglement. Absolutely right. These are all pre-malignant lesions, except the rhinophyma. It is not pre-malignant. If you look at actinitic keratosis, it leads to squamous cell carcinoma. Bovens, also squamous cell carcinoma. Paget's, it leads to apocrine sweat gland, intraepidermal adenocarcinoma. Mammary Paget's, intraductal mammary carcinoma. Then cutaneous horn, keratocanthoma, they lead to squamous cell carcinoma. Giant congenital pigmented nevus typically lead to development of malignant melanoma. Dysplastic nevus lead to superficial spreading type of melanoma. So you should punch this slide to put it into your memory box for setting up reminders. So there are few hiccups in the bookmarks and reminders in the UMedico app. Our guys are still working on Sunday to solve that. So by tomorrow they will update the one more version, and that will be a perfect UMedico version where you set reminder, you get a notification and it keep reminding you your bookmarks and notifications in the notes in the UMedico app. Now 50-year-old man, long history of swelling of right parotid gland. There is a nerve weakness and cytology was inconclusive. What is the best investigation you want to do in order to evaluate this patient who is having a parotid tumor with the nerve injury features? Very important clue. Nerve injury features. Excellent. Thank you, Rocket Trader. Still, I'm not still happy with the UMedico notes. I want notifications to come, and the voice you can record on each slide, your own mnemonic. So these features, our people are debugging few hiccups in the UMedico notes. We will upload the next version tomorrow by evening. Yeah. So I can see most of you saying MRI. Absolutely right, doctor. CT scan is superior to MRI if it is a bony structure. Whereas MRI is better if there is any inflammatory lesion. So if there is a diffuse enlargement of parotid gland, tumor extension beyond superficial lobe, facial nerve weakness, trismus, deep lobe of the parotid tumor, in all these cases, MRI is indicated. especially when the facial paralysis is there, is what you need to appreciate. A 70-year-old man smoking has a 1 centimeter ulcerative lesion in the vermilion of the upper lip. Very important clue. So please shoot your answer, doctor. What is your opinion on this lesion on the vermilion on the lip? Ditto, same question will come in the tomorrow's NEETPG exam. What is your answer? Very good. Monica and Monica, please don't break my heart. Very good. Monica says, sorry sir, it is basal cell carcinoma. Between cup and lip, there can be slips. But in the NEETPG, between your answer and what you thought, there should not be any slips. 1 mark gaya, ऐसे question के ऊपर 10,000 ranks पीछे पड़ जाते. So that's what you need to appreciate. So this is the vermilion on the lip के ऊपर, basal cell carcinoma. Once more, NEETPG examiner will give you the picture and expect you to look at it and discover it as a spotted as a basal cell carcinoma. 55-year-old, hoarseness of the voice for which direct laryngoscopy was done. Squamous cell carcinoma is being found, and the imaging has shown there is an extension to the deep neck structures and cartilage involvement is there. So you want to prove that the cartilage invasion, what is the best investigation is the question. CT scan is Monica's answer. Anybody else would like to think anything else other than CT? Abhishek also thinks it is CT scan. Absolutely right. Breast imaging, reporting and data system. What is that called as? BI-RADS. BI-RADS. Now, the final assessment categorized as category 5 disease. What is the meaning of this category 5 in the BI-RADS system? So, doctor, surgery के 30 questions में breast cancer के बिना अगर NEETPG conduct हुए तो मेरा जिम्मेदारी है. Exam is not for 300 marks, it is only for 299. 1 mark invariably in breast cancer. And the questions will not go beyond Bailey and Love. So you need not worry at all. Bailey and Love में कितना pages रहता है breast cancer के ऊपर? Hardly 4-5 pages रहता है, or maximum 10 pages. Not even 10, 5 to 6 pages. 5 to 6 pages, line to line, makki मार के exam जाना है. That is very important. So if you have done this question wrong, there is no excuse in breast cancer. All toppers will never do mistake on breast cancer. That's right. Read Bailey daily. Good, good. You are now picking a lot of my secret quotes. So some of you should become once more, after joining PG, teachers to come back and teach and inspire the future generation of students. So doctor, BI-RADS में 0 score का मतलब होता है no additional imaging required. 1 means negative. Continue annual screening mammography for women above the age of 40. BI-RADS score 2 means it is benign. Continue annual screening mammography. 3 means probably benign. You have to receive a 6-month follow-up mammogram. 4 means suspicious. You require biopsy. 5 means highly suggestive of cancer, requires biopsy. 6 means known biopsy proven malignancy, and biopsy confirms the cancer before the treatment is what you have to basically remember. So this is one image, doctor. You have to bookmark in your UMedico app. In a male patient, road traffic accident, blood at the tip of the urethral meatus. Once more, doctor. What is penile urethra? What is bulbar urethra? What is membranous urethra? How their injuries present? This is one favorite area of the examiner. So it is a classical presentation of the injury of the urethra is what you need to understand. So, blood at the tip of the penis in the men or the urethral opening in the women, blood in the urine, inability to urinate and pain during urination, they are the most common symptoms of the urethral injury is what you need to remember. One more breast question. See, how important is breast? 35-year-old woman has inflammatory carcinoma of the left breast. Very important clue. Mark, underline inflammatory breast carcinoma. Let me check how many of you are NEETPG ready. Clinically palpable 2 left axillary lymph nodes and no detectable mets. Okay, that's the reason everything is M0. So what is her TNM staging is a very important question. Question number 30. Rocket Trader is betting all the missiles on option B. Imran Khan also. Then Monica is thinking C. Okay. And Syed Ilyas is thinking D. Monica, Abhiraj Paul, Bhagyashri, Jindabad. So T4 D. D का importance क्या है? पहला TNM में tumor size less than 2 T1, tumor size 2 to 5 T2, tumor size more than 5 T3, tumor extends to the skin or chest wall is T4. No lymph node mets is N0, ipsilateral movable axillary nodes is N1, ipsilateral fixed axillary is N2, and metastasis to infraclavicular, supraclavicular lymph nodes is N3. That is what you need to appreciate. Now, a T4 जो है ना, इसमें T4A का मतलब क्या होता? Extension to the chest wall, not including only pectorals, muscle adherence. Then what is T4B? If there is an ulceration and or ipsilateral satellite nodes and or edema, but it does not yet meet the criteria of an inflammatory carcinoma. T4C is both T4A and T4B है तो T4D होता है inflammatory carcinoma is what you have to remember. So doctor, once more straight a question exam में आता है, मुरली भरद्वाज सर याद आता है. Now, Milan trial, NSCABP trial and erotic trial, EROTC trial of the breast cancer. What did they basically compare? Unfortunate thing is, botany zoology पढ़ के हम MBBS में एंटर होते और ऐसे ट्रायल्स पढ़ के हम MCH और DM एंट्रेंस लिखते. MD entrance is in the middle. So you get NEET UG like questions on malarial parasite and MCH and DM questions like trials. So both the types of questions come and join the question bank of the NEETPG. ये तो super duper above the over the head trial hai. But anyway, it compares breast conservative surgery versus mastectomy. Always, no woman want to lose her breast, and as a surgeon you try your best to conserve the breast. So, is this better or that is better? Mastectomy is better or breast conservative is better? Always there is a big debate, and that debate has been researched in these trials. National Surgical Adjuvant Breast and Bowel Project is NSCABP. European Organization of Research and Treatment of Cancer, erotic trial is basically conducted to compare these two factors is what need to be remembered. That's right. It's a Yorker. Now, regarding breast conservative therapy and the issue of post-operative local recurrence. These are all the true statements except what? One of the favorite questions of the examiner. What are the indications, prerequisites for you to do the breast conservative surgery? Let me check. How many of you will answer this correctly? So, आज शाम आप ब्रेस्ट कार्सिनोमा को एकदम मिक्सी में डाल के खत्म कर लेना, so that you are ready to pocket that one or two definite questions, definite marks in the exam. So, Prajakta, Bhagat, Seema, they are all differing between A versus C. But it is B. Roger is good guess. Very good guess by Roger. Roger Jindabad. So, doctor, what is the eligibility for the breast conservation? First is tumor size. Lumpectomy should be considered in which that you can be able to excise the tumor with a clear margin and leave a good cosmetic result. That is one criteria. Margins. You can reduce the recurrence if 2 to 3 millimeters microscopically clear margin can be obtained, and it should be clear from invasive cancer or ductal carcinoma in situ. Histology. If there is an invasive lobular carcinoma with an extensive intraductal component, if the clear margin can be achieved, then you can be able to do the breast conservation. Similarly, patient's age. Recurrence is higher in younger age, and that is reduced by using the radiotherapy. That is what you need to remember. So, this is one table आप UMedico app में notes में. Immediately tomorrow they will upload this notes and this video. So, you have to bookmark this slide and set up a reminder. 75-year-old diagnosed with a splenic artery aneurysm, and it is calcified. So, what do you want to offer in this given scenario is a very, very important question. So, I am very happy 150 of you are online attending this session. Question number 38. What is your answer, doctor? Can you buzz your answer? I can see D versus C. Vanishri is saying observation. Vanaparthi Vanishri MS General Surgery. I can write it on paper. Excellent. Bahut khush hua Mogambo. So, you should be sure that splenic artery aneurysm is rare. But the most common visceral aneurysm, if the question is being asked, splanchnic arterial aneurysm, it is a splenic artery aneurysm. Females 4:1. It is the middle to distal portion of the splenic artery, it usually arises. And you do plain X-ray where you can see that concentric calcification. You do an endovascular repair with a stent or graft is ideal, and simple ligation and excision of aneurysm is preferred over the splenectomy. But splenectomy is a requirement only if aneurysm is nearer to the hilum of the spleen, is what you have to appreciate. Choledochal cysts. Type 1, type 2, type 3, type 4. There will be 10 points on choledochal cysts. You can go back to the UMedico notes if you have done this wrong. You should know all those 10 points because every time examiner asks, only out of that 10. So, what is your answer for this question, doctor? Regarding when are they seen, how do you want to treat, which type is most common? Rocket Trader says C, Jitendra proposes B, Monica thinks C, and Ritu thinks A. Absolutely. You should remember, even Seema also is correct. Excellent. Choledochal or congenital cysts, 60% are diagnosed in pediatric age group before the age of 10, and there is an increased risk of cholangiocarcinoma in the people who are having older presentations. Type 1, which is the fusiform dilatation of the extrahepatic bile duct, is the most common type of the choledochal cyst, is what you need to basically understand. So now doctor, 55-year-old, right upper quadrant discomfort, jaundice, pruritus, fever, fatigue and weight loss. Serum bilirubin, alkaline phosphatase levels, they are all raised. And there is a history of inflammatory bowel disease. What is he most likely suffering from is a very, very important question. Question number 40. Should your answer, doctor, in this given case of inflammatory bowel disease? I say simple questions go. You should not do wrong. That's very important. That's right. Chinmay Ghosh, everyone, Jindabad. Primary sclerosing cholangitis, the chain of lake appearance. Classical. अगर आपको ERCP का इमेज दे दिया तो एग्जामिनर इज प्लानिंग टू डू दैट इन 2019 NEETPG. ERCP में वो इमेज देख के आप जंप करके आंसर करना प्राइमरी स्क्लेरोसिंग कोलैंजाइटिस बोल के. ओके, नाउ carcinoma gallbladder. What are the important features? What type of carcinoma? How does it present? Good or bad prognosis? What is your important, what is your answer? Question number 41. So, adenocarcinoma is the type which you see in 90% of cases. And even a benign biliary disease, carcinoma gallbladder, can have similar presentation with the jaundice, etc., etc. Most patients have advanced cancer and prognosis is unfortunately poor because of that reason. 45-year-old, cystic lesion in the lesser sac, endoscopic ultrasound guided aspiration shows amylase of 500 international units and CEA, which is elevated 500. What is he basically suffering from given these important findings? So, cystic lesion in the lesser sac, if you know the anatomy, you know very well it is a pancreatic lesion. So, considering the biochemical findings, Gunjan Palwa is answering pseudocyst with ductal communication. Gunjan Palwa is our new classmate. Very good. Gunjan, you are from which location? Across the country, from which place? Ranjit is proposing also pseudocyst. Okay. None of you could guess. It is a classical story of mucinous carcinoma of the pancreas, doctor. CEA is highly elevated, no? That's right. Very good. Gunjan is from Haryana. The winter in Haryana must be amazingly sweet and wonderful. So, you should be sure it is mucinous neoplasm. So, pseudocyst versus serous cystic neoplasm, mucinous cystic neoplasm, intraductal papillary mucinous neoplasm of the pancreas, इनके बीच में क्या क्या फर्क होता है? ये टेबल है ना डॉक्टर, बुक मार्क करना यू मेडिकेट के नोट्स में और रिमाइंडर सेटअप करना, बिकॉज it is one of the common question in pancreatic tumors that the examiner love to ask you in the tomorrow's exam. Okay, so a mucinous cystic neoplasm, thick walled mucocyst, smooth contour, egg-shell calcification, whereas serous cystic is central sunburst calcification. This question was asked many times in the previous AIMS question bank, JIPMER question bank. So which is all there in the UMedico app. Please review how it looks like on real radiology. These are all the things repeatedly asked. Pylorus preserving pancreatico duodenectomy. पहला क्यों करते हैं इसको? And वो करते वक्त what are all the organs or structures that are removed and what is preserved is the favorite question of the examiner. You preserve the stomach in the pylorus preserving pancreatico duodenectomy, whereas you remove gallbladder, head of pancreas, distal bile duct, all of them you basically remove. So stomach is what you need to remember. So there is a dumping syndrome and a late bile reflux if you happen to do without this pylorus preservation. So the main purpose of pylorus preserving pancreatico duodenectomy is to prevent the reflux of the bile and the dumping syndrome. They are the two important purposes is what you need to remember. So the duodenum 2 centimeters distal to the pylorus, distal CBD, gallbladder, head of the pancreas, retroperitoneal peripancreatic lymph nodes, and the jejunum's 10 centimeter up to ligament of Treves. They are the ones which are resected during the pylorus preserving pancreatico duodenectomy is what you need to remember. In Crohn's, what is a true statement? All of you know it is a full thickness bowel, fistula formation can occur. It has skip lesions, so it can go to any part of the GIT, but cryptabscesses are not common in case of the Crohn's. Glasgow Coma Scale. Let me check your answer. Lot of you will be clean bowled in answering this question. Little tricky question. Question number 45. Where do you use Glasgow Coma Scale? Yeah. 45. Monica thinks chest injury. 45. No, Monica. Akkireddy Madhavi also is thinking chest injury. I am not saying except. 45. Binchu Varghese. Excellent. Binchu Varghese, I am sure from Kerala. Head injury only. It is not complicated. It is not at all complicated question. It is a simple question. Right? So, but if you do wrong, there is a simple question. You will go 1000 ranks behind. So, that's important. Traumatic brain injuries को assess करने के लिए Glasgow Coma Scale, not any cause of loss of consciousness. Now, doctor, muscle relaxant which is ideal for the rapid intubation and the short procedures. This is one prognosis deciding question, doctor, in NEETPG. Let me check how many of you are answering this right. Question number 51. This decides your prognosis for exam. Think and answer. Oh, I can see C versus D versus B versus, at least nobody is saying A. Very good, very good. Krishna Saumya Jindabad. Saxamethonium is what you need to remember. It is basically a rapid intubation and quickly pseudocholinesterase will come and metabolize it. So recovery also is very fast. That is what you need to remember. Once more, all those who did this question wrong, no doctor, only one thing you have to do. Go back to the UMedico app today evening. Decide I am going to finish in anesthetics, anesthesia, muscle relaxants. Depolarizing, non-depolarizing differences, individual types, what are they renally excreted, liver excreted? Ready ho jana, muscle relaxant, without that muscle relaxant there is no paper. Don't dream of it. And your preparation is all about what examiner want and what are you ready to give. Examiner पूछेगा, आप दे देगा. Right? So, if you don't deliver what examiner is asking, you are out of the game, right? So please make it a point to review. So 22-year-old, pan masala sab kuch kha rahe hain, mouth opening became difficult, restricted tongue movement is there, classical of submucous fibrosis is what you have to basically remember. 56-year-old, claudication of both the buttocks, thighs and calves, history of impotence. Another classical story of Lerith syndrome, which is because of the aortoiliac occlusion is what you need to remember. What is the earliest sign that there is an impending burst abdomen? Whenever there is any serous discharge of the wound, that is an important thing that you will assess after you operate a case. How is the wound? All surgeons assess post-operatively, right? So it is a serous wound discharge. Thyroid may most common any given day is a papillary carcinoma. Biscuit question. Iska bhi wrong kare to then we are ready for 2020. 2020 NEETPG. No, we are all going to win in 2019. That should be the goal. Shortest shelf life is there for which important blood component is the question. So it is the platelets which have only 8 to 10 days of the life is what you have to remember. Now, infantile hypertrophic pyloric stenosis may, what do you see? You see a visible gastric peristalsis and a palpable hypertrophied pylorus is palpable. They are the two important features. A non-bilious vomiting is a classical feature of CHPS is what you need to remember. I'll go a little faster. Some questions where I want to check how good you are, I will stop and ask for your answers. Otherwise, this Sunday is not enough to finish 300. I mean, at least 100 questions. So, apologize if I go a little fast. But keep punching your answers, right? 24-year-old presents with sudden onset of right iliac fossa, marked pallor, hypotensive. What is the most likely possibility in this young married female? Upain, very good. Upain is our new friend. Ruptured ectopic pregnancy, absolutely right. Now, what is the most important part of intestinal anastomosis? इसको आंसर correctly answer करो यार, हम सीट दे देंगे आपको, right? 59. Let me check how good you are. 59 is for sale. Let me see. Please mention the question number. Abhishek, Vyas, Madhuri, Shweta, and Rajkumar. Everyone is saying submucosa. इलियास भाई, आप दोपहर इस एरिया में suturing techniques इसके बारे में रिविजन करना है, because everybody is answering correctly. Roger also should think why everyone is right, I am not able to, and then be sure on this topic. Afternoon he has to study. Submucosa has a high collagen and it is the most stable suture layer in all the part of the GIT. So, whenever you are putting an extramucosal suture, it should invariably contain the submucosa is what you have to remember. The best cure rate of the keloids. Best cure rate. How do you achieve the best cure rate is a very important question. So it is the triamcinolone injection of all options available has the best cure rate. 30-year-old G2P1L0. This question is also for sale. Should your answer? Know your prognosis. Right? So, nuchal fold thickness is 2.5. So, what is she possibly having? Question number 61. आपकी कुंडली और जन्म कुंडली और ज्योतिष की जांच कीजिए. आइए मुरली भरद्वाज के नीट पीजी चाय पे चर्चा सेशन के लिए कितने लोग करेक्ट करेगा अभी देख लेंगे. Tunu Bhatriya is saying B, and Sabyasachi is saying A. Okay. और कोई जांच करना चाहते हैं क्या? बाबूजी, करेक्ट आंसर का जरूरत है. न्यूक्लियर थिकनेस खाली 2.5 mm है. संतोष कोपुला. एक्सलेंट. खुश हुआ मोगैम्बो. Akash Rai also, Jindabad. So doctor, these are the seat deciding questions. Rayani Yatim, excellent. Normal pregnancy. Nuchal thickness more than 3 millimeters is an indicator of the anomalies 21, 18, 30. Less than 3 millimeter का मतलब होता है normal pregnancy. Shanti ही. So once more, antenatal monitoring, Down syndrome detection, ये सब फंडा आप रिविजन करना पड़ता है डॉक्टर. 26-year-old, this another garma garam question. You should answer this correctly. Let me check how many of you will answer. 26-year-old, blood pressure 160 by 110, congestive heart failure, proteinuria. Any of these drugs can be given, but one of them cannot be given. अब देखेंगे कौन आंसर करेगा, कौन बनेगा नीट पीजी पति. करेक्ट. प्रजक्ता भगत, Chandran are betting on A. Ankita thinks D. Roger also. And Ilyas, everybody D. Oh. Manas Agarwal D to the power of 20 times you want to go wrong. Minus 20. Right? Amit Sharma also thinks 10 times D. No, doctor. Methyl dopa is the answer. Very good. Only 2 of you who answered first have Prajakta Bhagat. They are correct. So, methyl dopa takes around 72 hours. अभी इमरजेंसी है तो आप मिथाइल डोपा को बुलाए तो पुलिस के जैसे चोर भाग के होटल 5-star होटल में बिरयानी खा के एरोप्लेन में बैठने के बाद पुलिस आते. सो मिथाइल डोपा टेक्स अ लॉन्ग टाइम. सो 72 hours for its effect to establish, and we don't have that kind of a luxury of time when there is a severe hypertension, so it has no role. But otherwise, in pregnancy associated hypertension, methyl dopa is safe and it is the drug of choice. That is agreed. Not in emergency. That is the point. Okay. Now, a pregnant woman, 30 weeks gestation, BP is 166 by 110, pulmonary edema, convulsions, you are giving max sulfate. Along with the max sulfate, which drug is known to show the drug interaction, so you don't give it. Let me see how many of you correctly answer. Right? अगर ये भी wrong किया तो 1+1 offer. आप hypertension in pregnancy, eclampsia, pre-eclampsia और एक बार मर्दन करना पड़ता. So Monica thinks furosemide. Hanif Muhammad also. Abhijit thinks labetalol. Tunu Bhatriya, Abhiraj Paul, Rocket Trader, Syed Ilyas, Gulam Bhatt. Absolutely right. Sublingual nifedipine and max sulfate, they show a interaction, synergistic effect, so better they are being avoided. A woman undergoing infertility treatment presents with a triplet pregnancy, hat-trick. What is the most probable drug that might have caused excessive ovulation leading to the multiple pregnancy is an important question. Question number 64. अभी देख लेंगे आप how much you are right. Raju, you can sit. बैठो, आप बैठो. Huh? So, yeah, shoot your answer. Shoot your answer, doctor. 64. I'm seeing clomiphene citrate reasonably okay, but triplet tak nahi jata. More powerful than clomiphene citrate. More powerful. Clomiphene citrate, one possibility, but more powerful than that. Right. Anybody answered B? Akhil. Akhil said B, right? Injection, HMG. What is HMG? Human menopausal gonadotropin, which is a 150 international unit injection from the urine of the women who are menopausal, provides FSH and LH, and that has a strong tendency for multiple pregnancy. Clomiphene also one way is a correct answer, but a woman has abdominal pain, nausea, amenorrhea, 5 to 6 weeks. For you to call it as ectopic pregnancy, what is the criteria? On the TV sonography and on the beta HCG levels. ये क्वेश्चन रॉन्ग करे तो मैं रोना शुरू करूंगा. Loudly I will start crying if you do this question wrong. You should not do this wrong. Let me check. Question number 65. What is your answer? Sam Singh, Prahlad, Soumya, Kalyani. Very good to see Kalyani. My elder sister also is Kalyani. My younger sister is Lavanya. So I am blessed to be born in a family with 3 sisters and 2 more brothers along with me. A very big family of a very middle class. When I was not even having money to pay when I was joining medical school. So, always my elder sister Kalyani used to be a great inspiration for me to become a doctor. So, though she belongs to a commerce background, when I was preparing for MBBS entrance, she used to ask me questions just the way I am doing for you. Though she is not a biology student. Those questions I do wrong, she used to tick, make me to once more review, and once more used to ask questions. So, we are a group of 4 guys. Every day, Didi ke saath baith ke, she used to be an inspiring force to tell that, hey, you did more wrongs, you did more wrongs. In entrance preparation, most important thing, doctor, is that inspiration to prepare, challenge to prepare. That is what is most important. Otherwise, you are all brilliant. You all know how to read yourself, right? So, very good. Few of you have answered C, like Vishalakshi. Who said correct answer? Beta HCG more than 2000 with no gestational sac in the uterus on TV sonography is what you need to remember. So, TV ultrasound में intrauterine gestational sac typically will be seen as early as 4 to 5 weeks of last menstrual period. Lowest level of the serum beta HCG, mark these words, at which the gestational sac is visible is at 1500 international units per liter. And the corresponding value for the transabdominal ultrasound is 6000 international units per liter. Then, when do you call it as ectopic pregnancy? Very important question. Beta HCG more than 1500, failure to doubling of the beta HCG every 48 hours, double ho jana. 1000 should become 2000, become 4000, become 8000, like that. Beta HCG should increase every 48 hours. But if it is not increasing at that speed, then that is called as ectopic pregnancy. There is active tuberculosis. She is on ATT. What is that recommendation among these 4, which is a wrong recommendation? Chalo, आपका आपका अदृष्ट की परीक्षा. Let me check how much you will be lucky to answer correctly. Ritu thinks D, clean bowl. Graceline also thinks D. Monica thinks D. Sean thinks D. Oh my God, D is so seductive. Huh? Okay. Okay. Vanaparti Vanishri Jindabad. Breastfeeding to the neonate is not, breastfeed the neonate is wrong. That, what are the contraindications for breastfeeding? Markedly inverted nipple rata in some of the mothers. Severe mastitis. If suppose mother and child don't have same infection, septicemia, nephritis, eclampsia, profuse hemorrhage, active TB is a contraindication for the breastfeeding is what you have to basically remember. That's right. Samsung rightly says, biscuit cushions, careful रहना. देखने में बहुत नाजुक दिखता है, मगर if you are not sure on your concept, shrewd on your authority in the knowledge, you are gone. So, question number 72. A woman in postpartum pregnancy, unripe cervix, you should not give misoprostol. In which situation? What is the contraindication? Question number 72. Asthma. Oh no. That's right. Divya Param, Sean Chaco, absolutely right. Why are you seduced by asthma? Asthma is wrong, doctor. Hanif Mahmood, everyone is right. Decompensated heart disease is a contraindication for the misoprostol, which is a prostaglandin fundamentally. Now, an overweight, hirsute woman, very important clue I am giving you. She came for contraception. So, what is that contraceptive, which is very good considering overweight, hirsute woman is an important clue. Question number 73. Should your answer, doctor? So, this kind of simple questions only the examiner is going to ask you in the forthcoming exam. Good. I can see Akhil and everyone answering cyproterone acetate. It is a weak androgen receptor antagonist which has got potent progesterone effect is what you need to remember. So it prevents the dihydrotestosterone binding to the receptors and it inhibits the LH release by its progestational activity, and because of its anti-androgenic effect, it will also take care of the hirsute effects. Hirsutism is what you need to remember. Now, what are the contraceptive options? Once more, you should go back, bookmark this slide if you have done it wrong, and if needed, you feel you will forget it, then you need to set up a reminder on the UMedico app. Contraceptive options for a 28-year-old woman breastfeeding, wanting to avoid pregnancy for a long interval. What is the best thing that you can give? So obviously, a intrauterine device containing levonorgestrel or 380A, Implanon, they are all the ones which are being preferred. If you are planning a long-term handling of this scenario, Ritu, Raj, Roger are absolutely right. The woman is using combined oral contraceptive. Then, what are the non-contraceptive benefits that oral contraceptives offer is a very important question. Question number 75 for sale. Let me check how many you will answer correctly. Once more, doctor. Without a question on OCPs, without a question on vasectomy, tubectomy, there is no entrance exam. At least 5 questions aayega contraception. Contraception is a common topic in SPM and also gynops. So ऐसा topics जो common रहता ना एक दो जगह पे, and also in pharmacology. Examiner will ask 4-5 questions. So be sure, if you did this question wrong, you have to run for life and review in the DNB, JIPMER, AIMS, all question bank video lectures in UMedico app. You have to review today evening. Thug of Hindustan, Gunjan Palwa, you have to run for life. Ranjit, you have to run, and OCP के concept में भी wrong करे तो कैसा मेरे भाई, 2 हफ्ते हैं, जागो. So protection against ovarian cancer, colorectal cancer, PID, they're all the non-contraceptive benefits is what you have to remember. 40-year-old lady, uterovaginal prolapse. What is the best way you can prevent recurrence? Another question directly putting gun on your jugular and asking you, do you like to tell me what is the truth? That is what examiner is asking you. Be sure, question number 76. Let me check how many of you will survive the tip of my pistol for you today. Otherwise, afternoon you have to revise the topic of prolapse. Kabir Nanda, dishum, ouch. Then Monica Sharma, dishum, done. Who else? Tip of the pistol. Dasari Sushmita survived the tip of the pistol. Very good. Very good. Akhil, ouch. Vanaparthi Vanishri, ouch. Today I am killing a lot of people, right? So, vaginal hysterectomy, as Vanaparthi Vanishri said, sacrospinocalpoplexy is considered to be the management. All of you should go. My UMedico ka pura, what topics you are reading, what views you are doing, what bookmarks you are doing, pura analytics मेरे आपके, मेरा भी एक administrative login रहता है, उसमें मुझे दिखता है कौन कैसे पढ़ रहे हैं रोज. I'm seeing some of you are studying even at midnight, 1 o'clock also watching videos and playing quizzes. I'm very happy on the UMedico app, you are getting very well engaged, right? So this topic you have to read, doctor, prolapse. All the prolapse theory, MCQ discussions, everything are there on the UMedico app, video library. So, vaginal hysterectomy. So, patient is 40-year-old, she can land up in a recurrence of walled prolapse, and to prevent that, you have to do sacrospinocalpoplexy. The Meckel, Culdoplasty, Moskowitz, they are all for the enteroceal repair or the prevention of the enteroceal formation is what you have to basically remember. Now, doctor, cervical mucus examination of 22-year-old infertile woman is basically done to look for hernia, Spinberkite, cellularity of mucosa, not for papilloma is what you need to remember. Now, in a 28-year-old infertile woman with an ovulation, what parameters indicate ovulation is there? So, basically the Insler score, vaginal smear, urinary LH levels, they are all the important indicators of the ovulation. Isme, what is the meaning of Insler score is the point now. Based on the cervical mucus, Spinberkite, Furning, cervix. Either cervix closed, partly open, open or very open. You will be giving the scoring. That is called as Insler's cervical score is what you have to remember. 30-year-old woman suffering from severe pain because of endometriosis. What are the options which are available for the management of her? Question number 79. If you answer, most of you answer this correctly, then I will skip the explanation and go. Otherwise, I will make you the endometriosis clinical management champions instantly. So, Ritu says sildenafil, Akhil, Nanda, everybody. Actually, sildenafil is a very cheap option given. Anybody can guess that it is not sildenafil. Sometimes examiner will also help you like that. So, anyway, whenever endometriosis is there, this is one table like a consultant MD gynops. You have to have it in your mind. They can have pain or infertility, either of the presentations. If there is a pain, if it is a mild to moderate pain, give a empiric treatment with OCPs or progestin. If it is a moderate to severe pain, then laparoscopically you have to do the diagnosis. Then you need to do surgical excision or ablation of those lesions. And post-surgically you have to give danazole, OCPs, GnRH agonists and progestins. Suppose if there is any recurrence, then you need to do medical therapy for about 6 to 9 months. And if there is an intractable pain and childbearing is not an important thing, in spite of all ablation of the lesions, if there is any recurrence and intractable pain, then that is an indication for hysterectomy and oophorectomy and getting rid of the underlying cause. Suppose infertility is the presenting feature, then you have to work up for all other factors. There may be endometriosis, but that may not be directly responsible for the infertility. That's very important to remember. So laparoscopically you have to prove endometriosis is there. You need to do surgical ablation of the lesions, and that becomes an indication for in vitro fertilization or the superovulation induction is what you need to remember. So this is one important table on endometriosis. Even closing the eyes you should remember, reproduce in the tomorrow's exam. Now doctor, placenta ka waste disposal comes under which class and how do you dispose? It is the incineration is considered to be for the anatomical waste. Janani Suraksha Yojana, isme, let me check, this is another tricky question. आप कैसे आंसर करेगा देखेंगे. Santosh Kopula, tomorrow only go to the PowerPoint notes of this which get uploaded and mark that endometriosis treatment as a reminder. Okay. So Kalyani thinks it is C. Vanishri also. Okay. 81. Most of you are all seduced by option C. But Mukesh is proposing D as a wrong answer. Okay. Anil Karpeti, congratulations. I cannot, I mean, this is one tricky question I told you in the beginning only. Basically, under Janani Suraksha, first of all, it is a 100% centrally sponsored scheme. Cash assistance is given to the mother in both high and low performing states, and it promotes institutional deliveries. ये सब चीजें ठीक है, मगर ASHA is a link between women and the government only in low performing states, whereas in high performing क्या होता है? जहाँ institutional delivery is more than 25%, there they use the Anganwadi worker as a link is what you have to basically remember. So what is the ideal time to perform postpartum sterilization according to the government of India? So from 24 hours up to 7 days of the delivery is the ideal time for postpartum sterilization. What is the regime for the medical abortion up to 7 weeks of gestation is very, very important. Let me check how good you are in this concept of MTP abortion. Once more, ये गाइनाप्स में आता है, फॉरेंसिक में आता है, एसपीएम में आता है. इतने 3 जगह पे आने के बाद भी आप तलाक बोले तो एग्जामिनर विल नॉट गिव यू एमडीसी. 3 बार बोलने के बाद, 3 जगह पे आने के बाद भी अगर रॉन्ग करे तो. क्वेश्चन नंबर 83, व्हाट इज योर आंसर? एवरीवन बोल रहा है बी, राइट? ओनली यदविंदर सिंह इज सेइंग ए. Absolutely. So Mr. Singh should go back and on the YouMedico app should review this topic of abortion. Yadvinder Singh. From where are you, Yadvinder? Amritsar, Patiala, or from where? So question number 83. 200 milligrams of mifepristone on day 1 followed by 400 micrograms of misoprostol on the day 3 is considered to be the important part of the regime is what you need to remember. So the most common sign of the rupture of a previous cesarean section during the labor. So what is an important sign that you want to look at? So you should remember a non-reassuring fetal heart rate pattern is a very, very important indication which you should remember. Serum CA125 levels can be raised in which situation? So I think Yagvinder Singh has missed my call. So my guess is you are from Patiala. So question number 85. So you should remember mature cystic teratoma of the ovary is accept, but even tubercular ascites, endometriosis also, in addition to epithelial ovarian cancer, you have a rise of the serum CA125. Very good. Yes, the Yadvinder Singh is from Ludhiana. Excellent, excellent, doctor. So a 30-year-old healthy woman decreased bleeding during the menstruation. What is the cause for her? Tuberculosis can lead to the endometrial atrophy, intrauterine adhesions like Asherman syndrome, breastfeeding due to anovulation. They all can lead to development of amenorrhea, but not endometriosis is what you need to remember. There's a frothy vaginal discharge, fishy smell. How do you want to treat? Treat the partner, use the condom by the partner. Metronidazole is considered to be the management. What happens during immediate puerperal period? What are the important changes in puerperium is an important question. Question number 93, let me check how good you are. Let me test your puerperal knowledge. 93. Monica thinks WBCs increase. So also Manas Agarwal, everybody, very good. That's right. So blood volume decreases slightly, cardiac output increases, RBC hematocrit return to normal by 8 weeks, leukocyte count increase, platelet count decrease, fibrinogen level high in the second week of puerperium. So these are the important puerperal hematological changes which you should be doubly sure about. Newly married couple. Best contraceptive to postpone the pregnancy for 1 year. It's a very common question, right? So it is a combined oral contraceptive. So for a teenage girl, low dose pills is contraceptive of choice. Newly married couple, once more low dose contraceptive pills. Post-abortal pills are ready, are ideal, but IUD is an alternative. Then postpartum, if non-lactating, it is pill or combined OCP or IUD. But if lactating, then low-dose progestin pill, that is a mini pill or an injectable steroid is considered to be ideal. Then women at risk of STDs, then condom and spermicides is what you need to remember. Let me check this question. Question number 95. What are the branches of the internal iliac artery, which is not a branch? Very important question, doctor. Isko bhi wrong kare to slightly poor prognosis. 95. हम फ्री कोचिंग दे देंगे आपको, कैसे भी फ्री दे रहे, यू मेडिको के ऊपर भी हम फ्री दे देंगे आपको. दाशरी is proposing ovarian artery. मितेश सुनील कुलकर्णी रेडी हो जाना फ्री कोचिंग के लिए. Then Simply Medi is saying B. Monica Sharma B. Abhishek Vyas C. Come on, doctor. Internal iliac artery branches, external iliac artery branches. One आर्टरी ब्रांचेस के बिना एग्जाम नहीं रहता. सबक्लेवियन, एक्सिलरी, फर्स्ट पार्ट, सेकंड पार्ट, थर्ड पार्ट क्या निकलेगा? Without one question on this is the branch of which artery, mark my word, इसके बिना 20 क्वेश्चंस नहीं होगा एनाटॉमी में. So ovarian comes directly from aorta, doctor. What is the famous mnemonic in the men's hostel for this internal iliac artery branches in a medical college? I love going to places in my own underwear is a famous boys hostel mnemonic. I is iliolumbar artery, L is lateral sacral artery, G is gluteal, superior and inferior gluteal arteries, P is internal pudendal artery, I is inferior vesical in case of women, vaginal artery, M is middle rectal, V is vaginal artery, O is obturator artery, U is umbilical artery and uterine artery in case of females. So these are, I love going places in my own underwear is internal iliac artery branches. You should not forget. Now doctor, 30-year-old multiparous woman comes with the ultrasound report of the fibroid uterus measuring 3 into 3 centimeters. Her only complaint in the mild pain during menstruation. So what is the best management in this is a very, very important question. Question number 95, 96, Monica says reassurance, Upain also, Kalyani thinks hysterectomy. Be little easy on this multiparous woman Kalyani, 30-year-old hai wo, right? So 96, that's good. Everyone is saying reassurance, absolutely right. The most accurate method for adenomyosis where you can see the diffuse enlargement of the uterus. Where can you see that? Classically, in the case of the MRI is what you need to remember. 97. Now, on ultrasonography, what is the diagnosis of a low-lying placenta is my question to all of you. So, placental edge which is not reaching the internal os and it is remaining 4 centimeters wide perimeter around the os, cervical os, is the definition of low-lying placenta. You have to be 100% sure. मैं बोल रहा हूँ ना डॉक्टर, ऑब्स्टेट्रिक्स गायनेकोलॉजी में 30 out of 30 मार्क के आना है अगर आप टॉपर बनने का ख्वाब देख रहे हैं तो. All toppers that I have seen, 90% they score in surgical subjects, gynocs and surgery, because there is nothing to guess. They're all facts, pure facts. Cardiovascular parameter that decreases in pregnancy. Pregnancy may high progesterone lead to vasodilatation. That's the reason that will decrease the arterial blood pressure is what you have to ultimately remember. A multipara, 8 gram% hemoglobin at 30 weeks of gestation. Let me check how many of you use a uncommonly available asset called common sense to answer this question, right? Question number 100, shoot your answer, doctor. 10 Amudan. Okay, 10 Amudan is from which part of Tamil Nadu? So, Surya Prabha thinks B. Most of you are thinking parenteral iron. Jitendra Kumar, clean bold. So, parenteral iron, because the time available is 30 weeks means hardly 4-5 weeks, just like NEETPG, forthcoming NEETPG. अगर आप oral iron therapy देते बैठ गए तो तेरा time लगेगा. So, parenteral iron is a little faster thing. But that is not too close that you need to jump for transfusion. It's not any postpartum pregnancy for you to do transfusion, but it is, you have 4 weeks of time, 4 to 5 weeks of time. Now, the progress of the labor, how do you basically monitor? The cervical dilatation, how it is increasing, the descent of the fetal head, the intensity of the uterine contractions, they're all the important indicators by which you can be able to judge how good the progress of the labor is what need to be remembered. Prophylactic intravenous methergine should not be given whenever there is any heart disease, is important contraindication. What is the ominous pattern? All of you know very well. Head compression is early deceleration. Variable compression is cord compression, and variable decelerations. And late decelerations are a sign of fatal hypoxia, and that's the reason you have to be very careful. There's a postpartum hemorrhage in a primary health center. So how do you want to basically treat? You need to assess the general condition, IV drip, and refer to the hospital. उसके बढ़कर क्या कर सकते हैं आप प्राइमरी हेल्थ सेंटर में बैठ के? 20-year-old, full dilatation of the cervix, breech presentation, but the breech is not engaged. Fetal heart is normal, full term में. What is the best way to manage this given scenario? अभी देखेंगे how many of you are pundits in obstetrics and pregnancy and labor management. Question number 105. Very good. Monica thinks it is cesarean. Kalyani also. Ritu also. Vanishri, you should not do wrong. Don't break my heart. Then Abhirash Paul, Sudha Shukla, everyone, all of you are ready. When to do cesarean, when to not do cesarean. Very common decision. If you look at overall perinatal mortality, it is 3 to 5 times higher if there is a breach. And if the breach is not engaged, it means there is a cord prolapse and it can lead to sudden intrauterine death. So that is the reason you need to do the cesarean. Now, what is the most significant risk factor for the postpartum psychosis? Most important thing is history of postpartum psychosis. ऑलरेडी पास्ट प्रेगनेंसी में साइकोटिक हुए तो इस प्रेगनेंसी में साइकोटिक होने का बहुत हाईएस्ट एसोसिएशन इज बीइंग फाउंड. फ्रैंक ब्रीच प्रेजेंटेशन में व्हाट इज द मेन कॉज ऑफ द पेरिनेटल मोर्टेलिटी? लेट मी चेक. दिस इज a biscuit question, but if you do wrong, I'll be sad. 107. Shoot your answers. 107, doctor. So I'm very happy to see 167 wonderful audience for the today's afternoon NEETPG mock test discussion. Most of you are saying D. D. Think and tell, doctor. Think and tell. मैं रोता हूँ. I will start crying. Commandant, Jindabad. Intracranial hemorrhage, doctor. Simple question. But they become loaded to answer. Vanaparthi Vanishri also. Excellent. Ranjit also saying C. Very good, doctor. Now, 45-year-old, continuous vaginal bleeding for 15 days. Her bleeding should be controlled by what? For 15 days she has got a continuous vaginal bleeding. These are all the common things in the day in, day out clinical practice. Question number 108. So, we have a YouTube channel called CuroChat. You type CUROCHAT, CuroChat. I want all of you to go and subscribe YouTube. That bell sign is there. No? Subscribe on CuroChat after this session is over. This CuroChat YouTube channel, we are putting thousands of patient education videos, actual clinical cases that helps the patients. I'm very happy. Yesterday, a lot of you went to the YouTube CuroChat and subscribed to increase the subscribed members, which will help us a lot. And after this session is over, please type CUROCHAT, CuroChat in the YouTube. You get the CuroChat channel. Just add your subscription. That helps us to increase and make that a very popular thing. Also share the CuroChat YouTube channel to your friends, family members, to your own patients. We are placing a lot of patient education videos, real-time experiences of the patients who tell their story that मुझे पेट में दर्द हो गया, 3 दिन से उल्टियाँ हो रहे थे और अस्पताल को आया डॉक्टर साहब, तो आने के बाद मेरा अल्ट्रासाउंड किया है, उसके वजह से ये डायग्नोसिस बोल के बोला डॉक्टर ने. So the patient attendants will give the actual story. Today what is missing for the medical students? If you listen the complete story of one SLE patient from the beginning to the end, you will never forget. So across country today it is possible because we are creating a lot of medical students to directly take the history, record it with the proper consent of the patient and upload the cases videos, complete case history videos into the CuroChat YouTube channel, and that will create a lot of both public awareness and also a medical education for the undergraduate students. So please subscribe. I want to see 1,000 subscriptions happening on the YouTube CuroChat channel. So please do that. So curettage followed by progestogens is a important way by which this 45-year-old woman can be held, can be taken care. Now, primary spasmodic dysmenorrhea in a young girl. So what is the first measure you want to do? Analgesics and antispasmodics obviously to take care. 44-year-old woman, polymenorrhea, D&C report shows not a atypical hyperplasia, simple hyperplasia of endometrium. So what is your protocol of endometrial hyperplasia clinical management? Today only you should revise if you do this wrong. Progestogen therapy. So whenever there are anovulatory cycles, there is no progesterone produced. That will make unopposed action of the estrogen that lead to development of a simple endometrial hyperplasia is what you have to remember. Now, primordial prevention kya hota hai even before the emergence of the risk factors. So if you ask to change the lifestyle to prevent stress, health education, and you tell first year MBBS onwards students to go to hospital, present cases, solve MCQs, have clinical discussions, attend the YouTube channel of Dr. Murali, that is an example of primordial prevention of the failure in NEETPG exam if you tell the first year students. So when the prevalence rate is used without any qualification, it is taken as a means of what? It is a point prevalence rate. It is basically, the definition is point prevalence rate. There's an outbreak of viral hepatitis A between June and August. Out of that, 6% cases occurred in July. So the exposure in the community of this infection kahan se ho raha hai? Multiple sources for a prolonged period of time is the one which is responsible for this kind of a seasonal pattern is what you need to remember. So how can you prevent rheumatic heart disease? It is the target population, high risk school going children screening is the one which you need to do, by which you can be able to prevent. Bordetella pertussis diphtheria toxoid को add करने के वजह से it enhances the antibody response of the diphtheria. So how is this achieved? Because Bordetella organism produces an endotoxin is what you need to appreciate. So the last question for the today's evening, post-exposure prophylaxis against HIV infection. It should not be delayed beyond how much period of time? Let me check how many of you answered this correctly. 146, question number 146. Abhishek Vyas saying 48 hours. Santosh Kopula saying 24 hours. Commandant is saying 4 hours. Excellent. First time when I had the HIV needle exposure, I started running from the ward across the road and ran into the medical shop to quickly buy the antiretroviral because I was not sure the hospital has a stock of that. So you should remember that if HIV needle stick injury happened, within 48 hours is it should not be delayed. Is a golden period is that first 48 hours, it should not be delayed. So with this we will conclude, doctor. Thanks for a patient listening. Those who attended this for first time, please remember every day evening 5 to 8 p.m. we have this free all 365 days. We revise all 19 subjects. I will also quickly declare the schedule for the 2019, the free sessions, which subject, which day, and how do we cover it. And please call our helpline 9000-868-356 and get a subscription on the U-Medico. You get a video library access. So see you all tomorrow evening at 5 p.m. Thank you very much.